Well, a very good morning. It's Monday morning, which means it is Medicare Monday, and we have none other than Gary Smith from the Gary Smith Agency. Good morning.
Good morning. Thank you for having me.
All right. Well, thank you for being here. Look, we talk about Medicare every Monday morning. Today, we're going to talk about Part D.
Yes. So the drug coverage.
That's okay. So I was like, what were the letters D for drugs?
That's right.
Got it. Tell us about Medicare Part D.
Yeah. So the Medicare drug coverage side. This is probably the most important aspect of someone's Medicare life, right? Besides looking up a doctor and looking up a doctor or a hospital to make sure they're in your network if you're going with an Advantage plan. Supplements, it doesn't matter. Everybody's got to have drug coverage, right? So no matter which way you go, unless you're a veteran using the VA or TRICARE member, TRICARE for life, you have to have drug coverage, right? And unfortunately, most of us are taking medications, right? Especially when you get to 65, 70 years of age. And then some of us are taking some expensive medications, right? That are actually making life better because it's saving your life and it's making you be able to enjoy your life and enjoy your grandkids, but it's expensive. And the costs change constantly. So yes, the drug coverage side of the Medicare world, as I say, is probably the most important side. It's the most complicated, right? Why? Because there's thousands of medication, hundreds of different pharmacies, which makes this what? Millions of combinations, right? I mean, because you're using pharmacy A, B, right? Your price could be X. But if you switch to pharmacy C, D, your price can change. Generics versus name brands. Sometimes you can't take a generic, so I have to take a name brand. Well, maybe that company doesn't cover that name brand. Like I said, that's where we spend when we sit down with somebody. Our typical appointments last an hour to an hour and 30, 45 minutes. We will spend half the time literally researching medications, pharmacies, making sure the drugs are covered. What if they're not covered? Now you got to go back to your doctor. We actually give you a list of these two drugs are not covered by any Medicare drug plan. So now you got to go back and talk to your doctor, get him or her to give you a list of alternatives. Now you got to shoot that back to me so that we can continue the process. Like I said, as I tell you, that is the most time consuming, but it's also the most important because again, if you get your medication wrong,
you're not helping yourself.
You're not helping yourself.
Absolutely.
Exactly.
So are there things right now that are changing with Part D that folks need to know about?
Good things, yes. So there is a good thing. For those people who are 70-something years old, y'all probably remember your drug cost per year was up here. Last year, they limited to $2,000 max out of pocket to you. So that's huge, right? Because a lot of medications are $700, $800, $900 a month. Insulin savings program is another one. Insulin savings program limited your drug cost to $35. That used to be the killer for everybody because you have insulin, you got to have it, you can't live without it, and the insurance and the drug companies want $900 for your insulin, $500 for your insulin. Well, your copay is not going to be $30 for a $500 medication. That math doesn't work. So you're going to pay a large portion of that cost for that copay, for that drug. And so the insulin was really driving the costs up. So when they passed the insulin savings program, that was huge because it limited it to $35. Now we got that limit, we got a $2,000 limit on your max out of pocket, goes up $100 every year, so this year it's $2,100. So that's really helped people with their pocketbook, because that could be a difference of you spending $10,000, $15,000 a year on your medication now versus $2,000, or this year $2,100. That's huge.
Yeah,
that's huge.
It's absolutely, especially when you're on a fixed income.
Oh, absolutely. You're making $1,200 a month, $1,500 a month Social Security. That's all you got, right? And yeah, your drug cost is the difference. So you having a little bit of extra money. So yeah, it's a big deal. Now on the insulin, we see this a lot. The insulin savings program only covers insulin, right? We now have a lot of drugs that are not insulin that all the doctors are prescribing. They come in a pen form, the quick pens. They look like insulin. They're advertised like insulin. They're not insulin.
So it doesn't fall under that
It doesn't fall under that category.
Wow.
And hence now, that thing costs $500, $600, $700, $800 a month, and your copay is obviously several $100s a month. Now, good news, max out of pocket at $2,100. But what if you don't have the $2,100? So that's a problem.
They're finding the loophole. So are there changes that folks should be concerned about, or is it the changes are relatively good?
The changes are relatively, each year the Medicare Part D, it's actually been improving. The pharmacies, now obviously we've all heard the PBM stories where the pharmacies, the mom and pop pharmacies are losing money. Guys, so y'all understand, the Walmarts of the world are losing money. The problem is your Walmart lady or your CVS lady who's filling your prescriptions, she's not complaining to you like the local mom and pop pharmacies are, right? That's a problem that's got to be addressed. It has not been addressed. The other major issue that started last year was not paying agents a commission. And we agents didn't mind that at first. It hurts, yes, right? But we were still able to help our clients. We're now not able to do, during the enrollment window of 25, they took us the ability away for us to even help them. Now there's a website that we use at Medicare.gov is where we go to run all the drugs and run the data. Luckily, they stepped up and now added a agent assist section in there, because prior to that, we could not assist you in that program legally, because it asks you, who are you, right? And it either has to be you or you better have power of attorney, which we talked about in one of our segments. So by adding that agent assist line, it's now going to allow your agents like us, because we don't want to leave you and throw you back out, right?
Sure.
I mean, that's not my goal. We know this is going to get fixed in the long run. They're going to have to go back and pay the agents to help people, because what if you don't have a computer? What if you have Parkinson's disease or some sort of illness that doesn't allow you to use a computer? You got one, but you can't use it because your fingers shake. Are you supposed to pick up the phone and call every single company to get a price comparison? We all know that's not going to work, right? So there will be a solution, there's no doubt.
It's coming down the pipeline, I'm sure. But that is the long and the short of it. There's a lot going on. We just scratched the surface.
Correct.
There's a good chance that you have more questions. You can scan the QR code that you see there to get the book, to get Gary's book. It answers a lot of questions. You can call the phone number you see on your screen, and Gary and his team can answer your questions and get you on the right track.
Yes, sir. Thank you.
Thanks for being here.
Yes, sir.